Hi, my name is Angelica Fleischer, and I'm a Global WASH Specialist with Humanity and Inclusion. Today, I'm going to talk about HI's experience in identifying technical priorities to support the inclusion of people with disabilities in emergency WASH programs. In order to identify the main challenges that WASH teams were facing in mainstreaming inclusion of people with disabilities in emergency response, we used the IASC guidelines as a framework and reviewed HI's experience in 4 countries: Haiti, Pakistan, Chad, and Ethiopia over a 6-month period. The findings come from reading project reports and meeting notes. As you'll see, all aspects of the 4 must-do actions are not covered in the following findings. Rather, they focus on the main issues that emerge from staff experience in the field. Meaningful participation focused primarily on the assessment and implementation phases, where we found that rapid assessment tools used after emergencies were not often adapted to consult people with disabilities. If there were tools, staff often had different levels of experience in knowing how to consult people with disabilities. Time constraints were also an issue, with proposals being developed too quickly to allow time for consultation with people with disabilities. In some cases, it also took time to identify people with disabilities, and the WASH team had already started construction and hygiene promotion activities by the time people were identified, which limited their input into the design and participation in implementation. Removing barriers for people with disabilities was also challenging. While many staff have an understanding of physical accessibility related to infrastructure, the concepts of reasonable accommodation and universal design are new. This is particularly true for ensuring information is accessible, as the focus is often on infrastructure. Staff experience in designing inclusive hygiene promotion activities, including IEC materials, was also very limited. Even when designs included physical accessibility, there were needs for site-level adaptations, such as space or topography, that needed to be taken into account and included in contractor agreements. Perhaps most importantly, because people with disabilities were not consulted before proposals were submitted, budgets often didn't include funds to ensure WASH services were inclusive. For empowering people with disabilities, stigma around disabilities was important to address first, and awareness-raising activities at the community level with leaders and the rest of the community helped to facilitate the inclusion of people with disabilities in community WASH structures. Disaggregating data is the final must-do action, and the use of the Washington Group questions is one way to allow data disaggregation, noting, though, that the Washington Group questions focus on functional impairments, not specific disabilities. Staff knowledge of the Washington Group questions was a primary constraint in including them in WASH surveys or information collection exercises. In other cases, when the data was collected, there were gaps in feedback with the M&E team, which meant the data was not always used in implementation. These findings help to prioritize the technical issues to focus on, which are listed here, and primarily focus on existing guidelines and tools, and making sure these are inclusive rather than developing new ones. Providing skills and consultation emerged as a specific need for many activities, including the design of infrastructure, adapting WASH NFI kits, ensuring project information is accessible, and ensuring hygiene promotion activities were inclusive. Cross-cutting issues around budget design and integrating the Washington Group questions into data collection are also areas of focus. In order to help new staff develop the knowledge and skills required to include people with disabilities in emergency response, including the 4 must-do actions and practical tools as a part of induction and just-in-time training approaches is a priority. And while it did not emerge specifically, the issue of stigma around disabilities and perceptions in our own organizations are important to understand and address before we can implement inclusive WASH programs. Thank you.